I started here at the beginning of 2008. I'm a pediatric orthopedic surgeon, and I take care of basically all sort of bone and joint problems in children, muscle problems, things related to broken bones, things that children are born with, like too many toes, or their hip is dislocated, or things that children develop, like curvature in their spine, like scoliosis. So yeah, I have a pretty broad practice in pediatric orthopedics. We have a great team here, and I have so many great employees here with so many great talents that are so diverse. And an example, Alvita Darby she's one of our cast techs. But she's also like the person that we send in if a patient's having a bad day. Alvita can spot them on the way in, and she sometimes intervenes before they even get into the room. And she says, "I don't know what's wrong with you, but you look like you need a hug." We do a lot of clubfoot treatment here, so I'm probably one of the busiest clubfoot treatment centers in the state. I'm going to tell you the truth about what your child has. I'm going to tell you the truth about what the different ways are to treat it, and I'm going to help you in your ability to make your own decision about it, because at the end of the day, the parents are the ones that make the decision, and I'm just there as a resource to be able to tell them what their options are. Yeah, so this is a patient who we treated for scoliosis for several years, and her curve progressed despite brace treatment, and so she ended up having surgery. She had these screws and rods put into her spine, and she's got a very balanced, nicely corrected appearance now, and she's really very happy with how things turned out for her back. We've got a very diverse group of surgeons here. We've got one of the only pediatric hand surgeons in the state working here, Dr. Lochner. We've got our own pediatric sports surgeon, Dr. Kunal Kalra. When you've got a 12-year-old with an ACL tear, not everyone can handle that because their growth plates are still open, they need special treatment. And we've got that expertise here. We've got 3 doctors that do scoliosis surgery here, which is a pretty big group. And we've just hired 2 more. Some of the problems really have very immediate and obvious solutions. If you have a broken bone and it needs a cast, we'll have a little conversation about it, and we're really comfortable with that kind of stuff. We take care of thousands of fractures a year. And then we have people that come in with other problems that are a little bit more complicated, and those people need more time because number one, you've got to sort of, from a technical standpoint, really be accurate with them about what it is that their child has. Because parents, when their child has an unexpected problem, usually are pretty freaked out. They don't know what to do. They've been on the internet. They've basically got a worst case scenario running through their mind. And I see a lot of people that come like that to see me, and they've sort of worked themselves up into a frenzy for something that's really maybe not so bad. The flip side is that they may be coming to see me for something that really is going to need a lot of work and is going to maybe need surgery. Talk about sleepless nights. Those parents are not going to be okay until everything's done. And I know because I have 2 boys myself who, broken bones, had surgery, all kinds of stuff, and it's very stressful. And so I want people to feel comfortable when they're getting their care. I want them to feel like the people giving them their care have their best interest at heart, that they care about them, that they care about every aspect of their life. I really love this hospital. I love the patients that we take care of, and I really like the people that run this hospital. I think that they have the best interest of children at heart.